Hello, everybody. My name is Jim Sallis. I am recording this talk in San Diego, and I hope it will be of interest to you. So I am going to bring up my slides, share them with you. Right. So you see that the name of my talk is Why Keep the Multiple Benefits of Physical Activity for the COVID-19 Pandemic a Secret. So I am affiliated with both the University of California, San Diego and the Australian Catholic University. And I'm pleased to make this presentation as part of the IOHSK 2022 conference. So I'm going to approach this topic of physical activity and COVID-19 somewhat as a personal journey, because that's how I have experienced it. So I will begin with giving you a brief description of how I got involved in the physical activity and COVID-19 topic in the first place. Then give an overview of multiple benefits of physical activity during the pandemic. And then good news about growing evidence of physical activity as a protective behavior for COVID. And then I'm going to switch to a separate topic, separate but related. And that is, how might built environments affect COVID-19? And then ending with some recommendations for physical activity professionals during and after COVID-19. So this is, you can think of this as two presentations in one. So in February 2020, as you recall, just as news about the pandemic was going worldwide, I gave a lecture in India on physical activity, immune function, inflammation, and cancer. Now, I am a psychologist by background, and I've been studying built environments for the past 20 years. So I have never been an expert in immune function and inflammation, but I felt it was important to talk about these things and how they're related to cancer in this conference in India. So I did a lot of homework. And then when we started shutting down the society all over the world, and the news was dominated by this viral disease, the coronavirus, I was confused and concerned why nobody was talking about how physical activity could really help with this. And so I became alarmed, and I said, well, if nobody else is going to talk about the benefits of physical activity during this pandemic, I'm going to. So I started that. And while I was thinking about what I was going to do, the world changed. And here you can see part of my, I live near the beach in San Diego, California. And this is what's called Pacific Beach. And in June, this area, this boardwalk area, is typically filled with walkers, runners, skaters, skateboarders, bicyclists. And then the beach is full of people playing Frisbee and other games and swimming and all kinds of things. And you can see that closed down because it was required to be closed down. So it's pretty obvious that the pandemic changed physical activity. And let me just give you a little bit of background there. Here's a paper that came out in 2021, and they were already able to summarize 64 studies on changes in physical activity and sedentary behavior during the pandemic. And so it's a little bit limited because they only use survey measures, but the results are pretty striking. Among adults, there were 45 studies, and the vast majority showed decreases in physical activity. So that's a lot of evidence there. And in 26 studies of, uh, of sedentary behavior, all showed increases, each and every one of them. Among youth, there are fewer studies, but 6 studies in all showed decreases in physical activity, and 5 studies all showed decreases in sedentary behavior. So clearly the pandemic is having an impact, and that's because, of course, schools were closed, so children could not have physical education or recess. In most countries, indoor gyms were closed. Places for dance were closed, and martial arts, and a lot of outdoor places, parks were closed, and playgrounds were closed at various times. And so people's ability to be active in places that they usually are active changed. And this just shows some variation in changes across different countries. And if you can see the diamonds, there when restrictions started. And so you can see when this restriction started, activity went down. And the same thing in this country, and the same thing in this country. And a little bit less dramatic, and the shutdown was later in the US. And then the boxes show when the restrictions were eased, um, uh, and activity levels started to come up in this country, the purple, which might be Italy, and in this one, and in this one. And you can see this red line that didn't change much. That's Sweden. And they didn't shut anything down for months and months and months. And this only goes through June 2020. But you can see that in general, activity was going down and was stimulated. That was triggered by the restrictions. But not all physical activity news was bad during the pandemic. There's a study that was published also in 2021 showing that in most locations in Canada, in the US, and across Europe, bicycling generally went up. Not everywhere. Ireland, it went way down. East Canada, it went way down, but it generally went up by substantial margins, 20, 30, 40%. So it really depends. And trails became very popular in the US. There were something like 200% increase in trail counts soon after the shutdowns. And I think there's still over 100% increase over 2019 levels. So when common places where people were got their activity were closed down, people looked for alternatives, and trails and bicycling were 2 of those. So so some good news there. But I was more interested in, well, what might the benefits of physical activity be for this infectious disease? And so I partnered with Mike Pratt, who's a physician and well known to many people. He used to work at the Centers for Disease Control. Now he's at the University of California, San Diego. And we looked at the literature, and we identified 6 benefits of physical activity during the pandemic. We thought this was urgently needed information, so we at first wrote this summary up as a opinion editorial piece for newspapers. But after getting it turned down and ignored by 6 newspapers, we decided, well, we're just going to have to put this in the scientific literature and wait a while for it to come out. But it was published in July of 2020 in this Brazilian journal, so it is widely available. And so let me just briefly identify these 6 benefits. So moderate intensity activity enhances immune function, and reduces inflammation. So it could reduce severity of infections. And walking is an ideal and accessible activity for most people because it's moderate intensity. There is some evidence that vigorous exercise that's really extensive, like a marathon, seems to temporarily reduce immune function. But of course, most people don't do vigorous exercise. So moderate intensity activity really helps with the two primary physiological systems that affect whether somebody's going to have severe infection or not, or whether COVID is going to damage their lungs. Because if your immune system works well, it picks up or it identifies invading virus or bacteria quickly and takes care of it. If it doesn't work so well, then your immune system is ineffective at dealing with the beginning of the infection. So you get a lot of infection, and that stimulates inflammation. And it's really mainly the inflammation that damages the lungs. So this is really poor to the COVID pandemic and its effects. And there's plenty of evidence that physical activity is good for immunity and inflammation. So this is really the most important thing. The second thing is moderate intensity activity, again, can improve almost all of the common chronic conditions that increase risk for severe COVID-19. So we hear about these underlying conditions and people who are obese or diabetic or have heart disease or cancer or had a transplant. They're all at increased risk for severe disease and death. This is really striking. About 95% of all COVID deaths have been in people with chronic conditions. That was true at the beginning of the pandemic, and it's remained true throughout 2021. So this shows that chronic disease and infectious disease are in fact highly related. And physical activity is good for just about every chronic disease. Third, moderate physical activity is one of the best stress management methods. And of course, the whole world has been under stress for over 2 years now. So that is very important. But also about stress, that stress creates imbalance of the hormone cortisol, that hormone or that imbalance also negatively affects immune function and inflammation. So stress reduction is yet another mechanism by which physical activity can improve immunity and inflammation. The fifth benefit, moderate physical activity produces antioxidants that reduce the severity of acute respiratory distress syndrome, which is a serious complication of COVID-19. So that's important for people who are hospitalized. And the sixth one, it's probably a surprise for most people. Both acute and chronic physical activity improve the immune responses to vaccines. And I'll illustrate with just one study. Older adults assigned to aerobic exercise at a moderate intensity level were 30 to 100% more likely than a flexibility or stretching control group to attain sufficient antibodies from flu vaccines. So these were not COVID vaccines, but this effect has been documented for multiple types of vaccines. So a couple of important learnings that I will pass on to you from my research on this is that this note here, that physical activity produces acute effects for most of these outcomes. So every time you go out for a walk, let's say, for example, your immune function is boosted. Your proclivity for inflammation is reduced, and your stress level is reduced, and your psychological well-being is increased. So you don't have to wait years. You don't have to exercise for 6 months to get these benefits. Every time you do a session of activity, you get these benefits. So that is key. Second thing that I learned, I had no idea that our muscles are chemical factories. They are biochemical factories. And when your muscles are active, they produce components of the immune system, and they produce anti-inflammatory compounds, and they have the short-term impacts on cortisol, and they produce antioxidants. So the muscles are really part of the immune system, which most people don't know, but only when they are active. So so you can see why I got pretty enthusiastic about the potential for physical activity to benefit the pandemic through multiple mechanisms. So just a couple of things here to focus on the mental health. Children's mental health in the US has been called a state of emergency. And you see on the right, pediatricians call it a mental health crisis among kids. And the Surgeon General has highlighted this. But still, even with this so-called state of emergency with physical activity, the well-documented benefits of physical activity for mental health, certainly in the United States, are not being communicated, are being ignored, and that, to me, is a problem. I don't know about other countries. Parents are figuring this out. And this is a national US survey of parents, and said which pillars of mental health, of children's mental health, have been compromised. The top one is socializing. About 60% of parents said, well, socializing is necessary for mental health, that's been compromised. Exercising was the second most. Almost 50% of parents said, yeah, well, my kids can't be mentally healthy because they're not exercising. And you can see other things: eating well, sleeping well, talking to parents, that sort of thing. But parents are understanding that the kids need to be active for their mental health. Public health profession has not figured that out yet, at least in the US. Okay. Okay, another action that I took to try to generate some interest in physical activity in the pandemic is I worked with 3 early career international colleagues, and so we can have a broad perspective. And we developed a physical activity and public health research agenda to inform COVID-19 policies and practices. So we thought that the lack of direct evidence of physical activity's relevance to COVID-19 itself may be inhibiting public health action. So we said, well, let's encourage people to generate data, and let's start looking at that. And so part of this article, which you can look up, is what we call the International Network of Coronavirus and Physical Activity Research. So it's basically a very simple registry where people can register their study ideas, or register their studies, or summarize their results, so that there's more a learning community, and we can hopefully generate some networking and collaborations internationally. So you might want to take a look at that. Okay, the next thing I want to talk about is one of the first studies that came out demonstrating that physical activity does seem to reduce the severity of COVID-19 outcomes. So this is a study that I was pleased to be a part of. It was led by Robert Sallis, who is no known relative of mine. But this was a very large study done in almost 50,000 adult patients. So this was, I think, an important study in this effort. So I'm going to take you through it. Okay, so this study evaluated the hypothesis that consistently meeting physical activity guidelines, 150 minutes per week, prior to diagnosis with COVID is associated with more favorable COVID outcomes among the infected adults. This was conducted at Kaiser Permanente, Southern California, which serves almost 5 million residents. So the inclusion criteria, they had to be a member older than 18 years. They had to have a positive COVID test or diagnosis before October 2020. And they had to have at least 3 outpatient visits that included an exercise vital sign prior to their diagnosis. And this exercise vital sign is in the electronic health record. And so what is the EVS? It's basically 2 simple questions that was verbally asked about their typical exercise in the previous 2 months. And you can see it there. How many days did you engage in moderate to strenuous activity like a brisk walk? And on average, how many minutes each day did you do that? And there's 2 studies that support the validity of this self-report as a physical activity measure. So it's as good as most any other. And we divided people into these 3 categories: consistently meeting physical activity guidelines. Only 6, and that means all 3 measures, or however many measures that they had to have at least 3. They at every one of their measures, they reported meeting the guidelines. And that was only about 6.5% that did that. It's still a big number, but only 6.5%. We're also looking at people who were just inactive. And they reported 0 to 10 minutes at every single assessment. There were 14% who did that. And then everybody else, the other 79%, were in between, or they had some variability. All right, so those are the groups. Now, there were almost this 48,000 patients with 3 or more EVS measures, and those are the ones that we studied. And 60% of those had 5 or more measures within the 2 years before. So it's we think it's a pretty good measure. This area has a very large Hispanic population. So this cohort is 65% Hispanic. You can see the mean BMI is in the obese range. So, and about 50% had at least one comorbidity. So that would be obesity or hypertension or cancer, cardiovascular disease, diabetes. Okay, and then the outcomes. These are the outcomes that we tried to predict. Of these 50,000, 8.6 were hospitalized, 2.4% admitted to the intensive care unit, and 1.6% died. And that's pretty similar to the national data in the early phases of the pandemic. And so we looked at the association between their exercise habits and outcomes. And we adjusted for these demographics and for many, many health conditions. I'll let you read them yourself. And these are all of the risk factors that were identified as underlying conditions for severe COVID outcomes. So we'll just go straight to the main findings. And I'm just showing the hospitalization and death results here. The ICU admission was similar. And so, so the inactive people compared to the always active, the inactive were 2.26 times more likely to be hospitalized. That's more than twice as likely to be hospitalized. And the totally inactive, this group, was 2.5 times more likely to die. And that's adjusting for all the other conditions and demographics. So what about the people who were in the middle? They were doing some activity. Well, so the inactive were about 20% more likely to be hospitalized than those with some activity, and 30% inactive were 30% more likely to die than those with some activity. So you see that some activity gives some benefit, but consistently meeting guidelines gives much more benefit. So this was the strongest association in the study, or with this out, for the active people. So this is a really strong result. And so meeting physical activity guidelines prior to diagnosis reduce the risk of severe COVID-19 outcomes substantially compared to being totally inactive. And this is very important. Inactive patients had higher risk for all severe outcomes than those with any other CDC risk factor except for age and history of transplant. And so you might notice you can't do anything about your age or your history of transplant, but you can do something about physical activity. And I consider these results conservative because they were adjusted for numerous chronic diseases that are in the causal pathway. So at the same time that physical activity was reducing their risk for COVID outcomes, it was reducing their risk for heart disease and cancer and diabetes, et cetera, as well. So anyway, we thought this was important, and we were very, very pleased that this study was covered in the New York Times same day that it was released in the journal, British Journal of Sports Medicine. And Gretchen Reynolds is the physical activity and exercise columnist. She highlighted it. And because mainly it was covered in the New York Times, it got picked up and reported in over 300 news stories worldwide, and I mean worldwide. It was it's been tweeted by over 11,000 people. And this alt metric is a score of its impact in the on media and social media. And the altmetric score was almost 9,000, which puts this in the top 1% of all scientific articles. Most scientific papers will get altmetric scores in single digits or double digits. So we were really happy that this got a lot of attention. But how has this message about the benefits of activity been incorporated into pandemic plans? Well, some good news. The World Health Organization identified inactivity as a COVID risk factor very early in the pandemic. They also organized a webinar series that encouraged promotion of physical activity as a pandemic strategy. And most countries have allowed physical activity during shutdowns as an essential activity, but few countries actively promoted physical activity as a solution. So I have a hot off the press update for you. I've been encouraging the Centers for Disease Control in the US to review the literature and do something about physical activity to use its power during the pandemic. And just February of this year, CDC added physical inactivity as an underlying condition for its COVID-19 outcomes. So it's physical inactivity is now one of about 20 of these underlying conditions. And this was based on a systematic review that CDC itself conducted, and they found 25 studies. So many more than the study that we published and in several countries. And their result was that the evidence from these 25 studies is conclusive and had mainly consistent findings across studies. So this is good. They're validating not only our Kaiser Permanente study, but what we tried to educate people about at the very beginning of the pandemic based on the existing evidence at that point. However, CDC at this point is not planning a public announcement about this evidence. I hope that changes. So there are now physical activity organizations in the U.S. that are developing a communication plan because the title of this talk is, why are we keeping this good news a secret? And so we're trying to get the word out now. And so unfortunately, physical activity and non-communicable diseases have not been part of current discussions about new pandemic strategy in the U.S. So the discussions are still about, well, we need to get people vaccinated, they need to wear masks, they need to be socially distanced, and they need to isolate. So it's the variations on the same things that we've been doing without doing anything about making people less vulnerable to the virus should they get it. And again, 95% of deaths in the US at least have been among people with chronic diseases. So I think we need a broader view of pandemic plans for the rest of this pandemic and preparing for the next one. So recommendations: let's stop keeping the benefits of physical activity a secret. Our strong Kaiser Permanente findings are now supported by 24 other studies, but still nobody's educating the public or even the professionals about the physical activity benefits. In future pandemics, I think we need to incorporate physical activity in prediction models to help balance the cost and benefits of restricting common places for physical activity. Now we have data on how much those restrictions affect, reduce physical activity, and we have data on how much physical activity can reduce the impact of the infections. So my key recommendation is that public health authorities should inform all populations that in addition to vaccination and following mitigation guidelines, engaging in regular physical activity may be the single most important action people can take to prevent severe COVID-19 and its complications, including death. And I think I would reinforce the usual exercise is medicine recommendations, which is that healthcare providers should assess, advise, and assist patients to be physically active during the pandemic, as they always should. That this really hasn't changed. So those are those recommendations. So that's the end of part one. I'm going to go to part two. What is the relevance of the built environment to the pandemic? For 20 years, myself and many other people around the world have been studying what's the relevant, how is built environment related to physical activity? So, and based on lots and lots of studies, we know people who live in walkable neighborhoods are generally more active and have fewer non-communicable diseases. But how does neighborhood design relate to COVID-19? So maybe I'll just explain this graphic here a little bit. On the left is a graphic of a walkable community, meaning it's mixed use. People live near shops, and so here there are shops and maybe offices in the same building as where people live. So you don't have to drive a lot of places. So there are lots of options for active transportation, good places, good sidewalks, good bike facilities, and good bus service. And there are connected streets, so people have many options to walk from place to place. here's an example of and oh yes, and on the left, high density, high residential density. On the right is the low walkable communities. And so you can see low density sprawl. So the houses, single family houses, they are separated, and so that there are big distances between where you live and where you might want to shop. And so and everything is built mainly for cars. Now you may have more parks in a low density area, but you're going to have much more infrastructure for cars, which creates barriers for walking and biking. And you have less bus service, and you have poorer infrastructure for walking and biking. So that's kind of what we're looking at here. Now, early in the pandemic, I was alarmed again by some very misguided statements. The governor of New York, which was the first hotspot for COVID in the US, said the density level in New York City is destructive. It has to stop now. New York City must develop an immediate plan to reduce density. So that was on the East Coast. On the West Coast, I saw this op-ed in the Los Angeles Times. How sprawl may have saved lives. And Angelenos like low density living, and COVID proves them right. Well, I found both of these were really misguided. And I wrote a letter to the editor in response to this sprawl article in the LA Times, and saying, if we reduce density, it's going to increase risk for chronic diseases every year, no matter what its impact on infectious diseases. So anyway, based on these kind of alarming statements, a colleague and I, Diti Atlaka, wrote a commentary for this journal, Cities and Health, that was published in a special COVID-19 edition. Dr. Adlaka at the time was in Belfast, Northern Ireland. Now she's at North Carolina State University. And you see the title, Activity-Friendly Neighborhoods Can Benefit Non-Communicable and Infectious Diseases. And to get the word out even more, we wrote this up in the Conversation, which is kind of an academic blog. So it would get wider distribution. And so one of the things we did is we tested this assertion that density is raising risks for COVID. And so this was based on June 2020 data, so it was early in the pandemic. But we looked at about 30 cities, and we looked at the correlation of density. So you can see the density here along the bottom with, in this case, cases of COVID-19. You see, New York City is an outlier. In terms of density, it's one of the less dense places compared to Dhaka and Manila and New Delhi and Mumbai. And you can see that there's really not much of a correlation. And if anything, the correlation is negative. So the higher densities at this stage of the pandemic had slightly fewer cases capita than the less dense cities. But it's cases are not good data most of the time. So let's look at deaths, which are better. And we see basically the same curve. It's slightly negative, but basically I'd say there's really no relation between density and COVID deaths. And you see, again, New York City, Madrid, they're outliers, but they're not demonstrating that density is behind their higher rates. Okay, so it's important to make the distinction between density versus crowding. So density is a number of people living in each unit area, such as a square mile. So you should be able to overcome that effect density by providing outdoor places for people to be and wearing masks and uh, social distancing, which they're not doing here. But crowding is something that happens at a more local level, like when people are crowded into workplace, like on this assembly line, or people are crowded into a bus or a subway. Well, that's crowding. Or you've got in low income areas, you've got three families living in a very small apartment. That's crowding. That's a harder problem to deal with, but we need to deal specifically with the problem of crowding, not overall density. So fortunately, things have turned around, and a lot of people were alarmed at this misguided worry about density. So you started to see articles like "Now is the time to embrace density." Let's use urban planning to solve the pandemic. And backlash against cities would be dangerous. And then this one, which I think is most to the point, dear Governor Cuomo, problem is crowding, not density. A lot of academics kind of uh, stood up and tried to educate. And here's a graphic that we put in our article. Um, so it's the expected net effects. We didn't have data for all of this, but this was some data and some mostly data for non-communicable disease, because we've been studying that for 20 years. We don't have so much data on infectious disease. So what about residential density? We know that's good for NCDs, and we showed in this little article that there was no association between residential density and infectious disease outcome. Mixed land use helps people be active. That's good for infection. That's good for heart disease and cancer. It's also good for building your immune system. Um, uh, Designing your transportation system to optimize it for automobiles, which is what we do in the US. Well, that has an unfavorable effect on chronic diseases, but you can be alone in your car. So that probably has a favorable effect on infectious diseases. What about public transportation? Well, that's very good. It's an active form of transportation, so it's good for chronic disease, but it certainly raises risk. And so that's a real challenge as we hopefully get past this pandemic and try to get people back onto public transportation. Okay, all of these others, good places for biking and walking, trails, parks, open spaces, open streets initiatives where you close streets down, at least temporary, for traffic and let people walk and bike and skate. All of those are good for chronic disease. And because it gets people outdoors, gives them a place to be active, it's not crowded, then we expect these three types of interventions to be favorable for infectious diseases. So, okay, so that's the data. That's what we asserted in June of 2020, and now there's some data to support that. Pretty fresh data from my colleague Larry Frank, who I've been working with for many years, and his colleague Baram Wali. And I like the title, Treating Two Pandemics for the Price of One: Chronic and Infectious Disease Impacts of the Built Environment, Natural Environment. So you see, that's exactly what we were talking about in our 2020 paper. So this is a national study in the US where had data for residential density, street intersection density, which means that people walking have direct routes, mixed use, So things are within walking distance, and tree canopy, which is greenness, and people makes it better for people to be outdoors and active, and had those data for each U.S. county, as well as COVID infection rates and mortality for each county as of mid-February 2021, about a year ago. And so what they found was that indicators of better walkability and greenness were related to both less obesity and lower COVID-19 mortality, as we predict. Secondly, they tested whether the built environment worked through obesity to affect COVID mortality. And they found that the built environment had both direct and indirect effects through obesity. That basically had pretty strong, if you build a place that's good for people to be active, it's good for both obesity in this case and COVID-19 mortality. But they found heterogeneity of effects that was driven by age, income, and race ethnicity. So there were variations in the associations between built environment and COVID mortality, depending on the exact location. Okay, so as we wrap up, what are the active design recommendations? One is, I think, as a field of physical activity, we need to continue advocating for active, healthy, and sustainable cities. And we now have evidence that active city design helps protect people from both infectious and chronic diseases. So we need mixed land use so people can walk destinations. We need good sidewalks and protected cycleways so people feel safe walking and biking. And we need parks and green areas that are helpful for both physical activity and physical and mental health. We're going to need to advocate and work or return to public transit use with adequate safety measures. And we need to retain the expansions of ciclovías or open streets and permanent street closures to cars, make more pedestrian areas, and parklets in parking spaces so that more people can eat outdoors, or you have little parks in these tiny parks and parking spaces. And I would say that we also need to educate infectious disease experts about, one, the importance of physical activity for infectious disease control, and two, the role that active design can play in reducing vulnerabilities in whole populations. So I hope you've gotten something out of this presentation. And since we're talking about death and pandemics and mortality and all of that, I thought I would end on something positive. And like probably many people, I did a lot more walking around my neighborhood during the pandemic. And especially early on, I saw a lot of these chalk drawings where neighbors were trying to cheer up their neighbors. So this one on the left, it says, "Happy Friday, be kind, smile, be thankful." So that's putting us in a positive frame of mind. And this one is actually promoting activity and pointing that you're about to enter the silly walk zone. So that sounds great to me, and I don't mind walking silly. It's going to make me feel better. So thank you for paying attention to this talk, and hopefully you'll have some questions that we can address either right after this or in writing. So bye-bye, and everybody be well.